You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering dental implants. My first guest is an expert on the topic, Dr. Wayne Brueggen. Dr. Brueggen, welcome to the program.
Well, thank you for having me, Randy.
Now, before we get into today's topic, Brueggen Dental, one of the busiest practices in all of Houston. What type of patients do you see there?
Randy, we see all kinds of patients. You know, it's a family practice. My passion's dental implants, but I have an associate, Dr. Ernie Escobar, and another gentleman there that does periodontal work. So we do everything from veneers, cosmetic dentistry, to root canals and crowns and everything. So
not just dental implants, but that's a big part of your focus, isn't it?
Well, it's primarily all that I do.
It's all that you do.
That's correct.
Now, background and training. You've been doing dental implants since 1976.
Yeah, you know, it was always intriguing to me. When I got out of school in '76, I went to work for a gentleman that did nothing but dentures. All he did. He was a dentist. I made him a set of dentures, so obviously that's what his patients had. Well, it didn't take very long for me to realize that the folks that were wearing dentures were crippled. They had some really serious problems, and there was no solution to them. Things that we were doing traditionally in dentistry just didn't work for most people, or for many at least.
So denture wearers benefit the most, you say?
I think that probably wouldn't be wrong to say, but the people who benefit the most are people who either don't have any teeth, or they've been told by their dentist that they can't keep the ones they have. They're about to not have any teeth. Those are the people that benefit the most. But anyone who's missing a tooth or a few teeth
should go with dental implants.
Absolutely.
Sounds very painful, by the way, going through the process, getting a dental implant put in.
Well, you sound like a typical patient.
All right. Is that their fear? Is that what they say to you?
Yeah, you bet. Most people would think that having an implant placed would be a difficult procedure, uncomfortable, but it isn't. You know, I told you a moment ago that one of the things that have changed a lot are the techniques, and that's the biggest thing. The surgeries right now they're so gentle, they're so non-invasive. If incisions are made at all, they're so small. The healing time is almost insignificant.
So they don't complain about pain?
No, Randy, they don't. I know it's hard for you to believe. It's hard for everyone to believe that hasn't had it done, but they don't. The reality is I have patients come in, Randy, that have a dozen teeth removed, have implants placed, and have a full set of new teeth put on those the same day. That evening they're eating a light meal, and the next day they're back at work. They're taking a little Motrin. I mean, that's how it is.
Now, is it because now there's not a lot of pain because the bone itself, you know, putting it in, that's not painful? Is that right? I mean, there's no feeling in the bone.
That's true. And so the only feeling that you're going to have is what's in the tissues, and since the incisions are so small, there's not much to it.
What about the age ranges of your patients?
My youngest was 21, my oldest was 96.
96. Now, why would a 96-year-old want to get dental implants?
Well, same reason you would. They want to have a good quality of life. They want to be able to smile and speak and eat the things they enjoy. It may be more important to them. They may have fewer things that they're getting to enjoy in their life than you are.
So a 98-year-old is healthy enough to get a dental implant?
Sure.
Okay.
Absolutely.
And they stay now. And was it painful for that person?
No. It's no different than it would be for anyone else.
Is that right?
Yeah.
Now, anticipating this interview, my mother, she's 73 years old, and she's been a denture since she was 28. So that's a long time. That's a long time. And she tells me, she says, Randy, because I told her about you, we had a conversation on the phone. Says I'm too old. My medical doctor said I'm too old for dental implants. I mean, is that common?
Well, I hear it all the time.
And is it true?
Well, it isn't true, obviously, and I think you need to let me talk to your mom for you.
Okay,
because she doesn't have to live like this.
She doesn't believe
it. Doesn't. I know she doesn't. A lot of people don't, but it's true. She's been wearing these things for so long, she doesn't even realize the compromises she makes. She eats the things that she can eat. That's what she's become accustomed to.
Does she avoid certain foods?
Oh, well, of course, and she probably doesn't even really think about it much.
What about, I mean, is she going to have to get a bone graft? I mean, somebody that's in their 70s? 70's young today, but, I mean, are you doing a lot of bone grafting?
Not much. She might not, but not much.
Is it coming from the hip?
It could.
Or you have synthetic materials?
It could, both.
Okay.
All of those things. But the reality is that, especially for about the last maybe 8 years of my practice, I've really focused on trying to find approaches that allow me to do these reconstructions without the grafts. Obviously, I can't do it every time, but I can do it almost every time. On the lower, virtually 100%, I can rebuild without any grafting at all.
So what are the different categories of dental implant patients that you see?
Well, you know, Randy, it's fairly obvious. You have a patient sometimes that maybe they just are missing one tooth. That's a category of a dental implant patient. You have others that may be for, who knows, any number of reasons. They may be missing 3 or 4 or 5 teeth. That's another category. And then you have a patient who either has no teeth or they're about to have no teeth and they need dental implants. That's another category.
You say people hang on to their teeth too long. They go to their general dentist, they say, your teeth have to go, and they still hold on to them.
Well, some do, some don't,
okay,
Randy. You know, some don't hang on to them long enough. But oftentimes, especially because as dentists, we were all trained to keep a tooth for as long as we possibly could. That's just what we're taught to do. They're almost sacred to us. And in the past, implants have not been the dependable solution that they are today, and so we've made tremendous efforts to keep people's natural teeth. So between us and our patient who naturally wants to keep them, we hang on to them too long.
So would you like to see more of those patients, the people that are watching this, that they've been told your teeth have to go? And they have a choice, I guess, between dentures and dental implants.
Well, not only would I like to see those patients, but every one of those patients would like to see me or someone like me. No one in the world wants to remove their teeth and go into dentures unless they
well, why does everybody do it? Because I mean, I'm looking online, 20 million people are wearing either an upper or lower denture. If it's as good as you say it is, why aren't they all doing it?
Well, there are 2 or 3 reasons they don't do it. One of the reasons is because of the dentists themselves. As I mentioned to you earlier, we were not trained in 1976 in school to do dental implants. Dental implants is something that has come along over the last 30 years. And
so it's new to even a lot of dentists?
And now it's becoming fairly mainstream, but you know, for a dentist who's been practicing for 25 years that didn't get any of it when he was in school, it's new to him.
So denture wearers, you say they don't really go to the dentist very often?
Well, no, they don't.
So nobody's telling them to do it?
You know, they think they don't need to go anymore. They don't have teeth any longer. Now, their dentist isn't telling them that. Every dentist who's taking care of a patient in dentures tells them he'd like to see them once a year, but they don't do it.
They don't go.
No, they don't go.
And they don't like dentists. I guess when people that have lost their teeth have gone through so much, the last thing they want to do is go see another dentist, right?
Well, that's a good observation. You know, obviously, anyone who's wearing a denture hasn't had a happy life in a dental office, and it's probably not their favorite place to be. Absolutely, that's true.
Okay, the interesting thing, though, you say that nowadays with as little as 4 implants, a denture wearer, lower denture, can get something fixed in their mouth. Is that correct?
Lower. Upper or lower, absolutely.
Is that right? Because people, I guess, you know, going into this, you know, you count your teeth, and my mother too, you know, she said, what's, you know, it's very expensive, but you say 4 implants, and that's it.
Yeah, you know, that's a good observation as well, because I have people that email me all the time, and their question is, well, I need a full set of dental implants. And a full set of dental implants to them probably means an implant for, I'm not sure what it means when they say that, but it probably means an implant for each tooth. And they're asking me, well, what do we do? How do I go about doing that? What's it going to cost to do that? How long is it going to take? What's it going to be like? The truth is, they're not looking at the same thing I'm looking at. They're looking at 1 implant for each tooth, and I'm looking at putting in 4, 5, 6 implants, usually 4, and building a full set of teeth on them. So I tell them, come see me and we'll take a look and talk about it.
One of the things I thought was great on the phone, you say that if there was a try-in period for denture wearers nationwide, where you could give them 4 to give them something fixed, they couldn't go back. You believe that? I mean, do you really believe that?
There's nothing in the world I believe more than I have never, ever had one patient, and I've been doing this for over 30 years, and I've been doing this 4 implant business with the fixed hybrid that we're talking about right now in one day.
So one day, somebody without teeth goes in, the right candidate, and you give them something fixed in their mouth.
Yeah, and I have never, ever seen anyone who would be willing to go back under any circumstance.
You say you're changing people's lives. You brought some photos. We're going to take a quick break first. Come back. And we'll talk about the process too, and also the different options for denture wearers. You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Up next, I've taken a look at these photos, dramatic photos. If you are wearing a denture, you have to see this next segment. We'll be right back.